Hi, I'm Kelty and I'm from One-to-One Wellness Center, and I'm going to teach you something today. It's a somatic exercise that is all about moving the shoulder blade. It's called the shoulder blade pain eliminator. So the focus is entirely on movement of the shoulder blade, and that is the one thing that you have to think about the entire time. So we're going to start with both arms up in this position. So elbows are together and hands are together. So what Jolene is going to do is she's going to start to see what is the range of the moment from this position. So we're going to start with the right elbow moving out. The movement again is all about the shoulder blade moving off to the side along the rib cage, coming back in. Thinking about that in the entire time. So we'll do that maybe 3, 4, 5 times, whatever feels kind of good. Allow that shoulder blade to rise up and come back down. You're going to then repeat that on the other side. Let's say it's a left shoulder issue that we're dealing with. I'm going to get Jolene to lay on her right side towards me. So again, it's the left shoulder. So it's the left shoulder blade that we're going to be working on. So all the movement needs to be taking place with the shoulder blade moving, so all the muscles around the shoulder blade are doing this movement. So anything on the back should be the primary movers, nothing on the top of the arm. That's the first place you'll use it, especially if you have a shoulder injury. You want the shoulder blade kicking in. So the hands will still stay together. The top elbow will then lift up, but the way it's going to lift is the shoulder blade is moving back and lifting up. Very slowly, very gently. And as she's doing that, she's thinking about letting the pecs, the chest muscles, release their hold, because they're often very tight. We're going to let them slowly come back down. That's an excellent speed. Again, the shoulder blade is moving forward, going towards the front of the rib cage. We're going to lift that up. Nice and slow movement starts again at the shoulder blade. The elbow lifts up, the chest releases, the neck's nice and relaxed, coming back down nice and slowly. Let's say you do that 3, 4 times, doesn't really matter. Your therapist will instruct you however they think is best. Then we're going to change it up a little bit. So the head is now going to rotate in the same direction as the elbow. So Jolene's going to look up to the ceiling. The top elbow does the same thing. All the movement's done again at the shoulder blade. She's going to come back down. We'll do that one more time. So shoulder blade's moving, neck is moving, all very gentle, all very slowly, all within pain-free ranges of motion. So then to mix it up a bit, we're going to get her to look down into the pillow, but the elbow is still doing the same. So the head's going to look down to the pillow, and we're going to lift up here. But Jolene's going to try to keep her hands a little bit closer together, because I don't want a huge movement. I want the quality of movement, not the range of movement. So again, still releasing, still moving, it's just that the head's moving down. Nice and slow, perfect job. We'll do one more. So the head's looking down to the pillow, the movement's all down at the shoulder blade, and lifting up. Perfect. Then we're going to try something different. We're going to lay on your back. The arms will be in the same starting position, but instead of moving laterally, they're going to move upwards, okay? So the hands are still going to be together, the elbows are still going to be together if possible. If they don't meet, that's fine. They're going to come up over the head. The shoulder blades are rising up, moving up. Feel that movement, that's the point. Coming back down. Always the return. The return is as important as the movement. Lifting up, nice and slow. Shoulder blades moving up, and then slowly coming back down. And it depends on what your therapist says, but generally 5 to 10 times, whatever feels kind of good. If it's going well, you can have a good time with that.